Good morning. Today's topic is depression and cardiovascular disease. All along that we have found out that in language and in literature there was an interdependence, that what the mind thinks, the heart feels. All our spiritual literature talk about that. But in 1628, English physician William Harvey, he told that every affection of the mind, may it be pain or pleasure, hope or fear, cause an agitation whose influence extends to the heart. You must have heard a person gets 50 lakh lottery and suddenly, lo and behold, he is found dead. Some mishap happens, he dies immediately. So it has been observed all along. But 1628, the physician who found the circulation in the blood, he described that our mind and heart, they are one. And more to say, the religious literature describes heart is above the mind. If your heart is all right, you will never suffer in life. If your mind is all right, you may suffer. But if you keep your heart happy, you will never suffer in life. That is what the spiritual literature and now science also describes. Keep your heart all right, your mind will follow. So we will just for DND students will say what is a MDD, that is major depressive disorder. There are few criteria. DSM-4, now DSM-5 is coming, but now we have come up to DSM-4 and DSM-4R. It requires 5 of the following symptoms. 5. The most important, one of the symptoms must be either depressed mood or anhedonia. It must be this depressed mood or anhedonia. These two are very important. And the symptoms must be present nearly every day for 2 weeks. That is what is important. Suppose somebody gives you a bang and you feel depressed temporarily for half an hour, 15 minutes, then you recover. You do all work along. That is not what is called depression. That is not what is called depression. Depression is the person must be the depression must present almost all the day along and for at least 2 weeks. If it does not, then DSM-4 says it is not a depression. It is simple, some mood change. It will go away automatically. You need treatment if the person has minimum one among the 1 and 2, sustained sadness of mood or loss of interest in almost all activities. This one of the 2 symptoms must be present. In addition, 4 out of rest. This rest, you want 4 among them, but 1 must be this, and most of the day for 2 weeks. That is what is criteria.
Anhedonia क्या?
Anhedonia is the loss of interest in all pleasurable activities. And for DNB students, it has been described in SIGA caps. This is the mnemonics to remember, and you all know. There is one important article published in Journal of Medical Association, 1993. They followed the patients were not depressed at the onset of myocardial infarction. They followed it for 6 months. They wanted to evaluate if major depressive disorder in patients hospitalized after MI would have an independent impact on mortality for 6 months. To their surprise, they prospectively evaluated 222 patients. 222 patients. It was a male predominant sample. They found out that later on, depression set in after the initial onset of myocardial infarction, and they found out that depression was significant predictor of mortality with odds ratio 5.74, and P was also highly significant. They controlled for this left ventricular ejection fraction Phillips class previous MIs, still odds ratio was 4.29. So it is sure the person may not be depressed all along, but after an MI, the physician or doctors attending the patient must always see whether at any point of time depression has set in or not. Why? Because it is important for the prognosis of the long-term, immediate short-term and also long-term prognosis of the patient. So this is they found out that 82 were depressed and 140 non-depressed MIs out of these 222. And you will find out that how significantly it affects the mortality. Another study was published in Circulation in 1995. They did 18 months prognosis after an MI. So they also Phillips class, PVC, previous MI, all they controlled. It was a study by non-psychiatrists. This is most important because now psychiatrists are not studying because they are busy earning. The heart people are studying because it affects them. It affects the mortality and morbidity, affects their reputation. Their reputation. All these studies are done by not psychiatrists, by cardiologists. The death that occurred in 8-month follow-up was concentrated, but this is one important. Those people who have PVC more than 10 hours, they were significantly, if they have depression, the mortality and morbidity is much more severe. Another study was published in American Journal of Cardiology in 1996. They found out depression and long-term mortal leads with coronary artery disease. They studied a big sample. In America, 1250 means it's a very big sample. Very big sample. And they studied for 15.2 long years. 15.2 long years. It is very, very difficult study. Probably it may impossible in our setup. The patients were enrolled at the time of first onset of coronary artery disease and followed for 6 and every 6 and 12 months, then annually up to 15.2 years. They found out higher the depression score, that the increased risk of cardiac death. If the depression score was higher, the person is either going to be disabled for a long time or will die. This is what is important. Persons having moderate to severe depression also have 69% higher incidence of mortality and morbidity. And patients with a higher depression, much more higher severe, they have higher risk of cardiac deaths even after 5 years. So that means it requires very, very long term and very, very intensive follow-up. That is what is important. Another study, the 284 hospitalized patients. This is a study. They have also found that depression has 84% greater risk at 5 to 10 years later and 72% even after 10 years. Even after 10 years. However, increased mortality was very significant in short term, 4 to 6 months. It was very highly significant. Another study was from the American Journal of Cardiology as recent as 2008. You know A study to be published requires at least 1 year to 2 years. So this study must have been conducted before 2007. So it was published in 2008. On all acute coronary syndrome, they did a 12-month follow-up. The idea to tell about so many studies is just to impress upon you that it is very, very important. All doctors, even MBBS, those who have done not post-graduation, they also, if they also must watch, because they are the main eyes and ears of a cardiologist. Unless you refer, patient will not go to cardiology clinic. You are very, very important for a cardiologist. You are the eyes and ears. You have to find out whether the person depressed at your OPD follow-up. Then refer to the cardiology clinic. That is what is important, because it is very, very important. And another important study was published in Archives of Internal Medicine. This time it was very important because doctors were inducted in this study. Doctors. They studied 1199 male medical students between 1948 to 64. You see how painstaking the study must have been. Between 1948 to 64 and followed for 40 long years. 40 long years. The Americans, they understand more religion than us. Our literature in Gita has described it described the Arjuna's predicament at the onset of war. They have described beautifully how depression and anxiety affects a person's performance and how it affects person's heart. We have known all along but never studied it. We just worshipped as a book. But see the Americans, how beautifully they have studied, and this time they studied the doctors who will be themselves. They've given them all questionnaires. They've told them the details about this study, and they've told them that you people will follow for 40 long years. And they found out the density depression at 12% in multivariate analysis. This time the study was very, very painstakingly taking all into account. They took all account that the smoking habit, all whatever possible, because they were doctors with the sample. Still they found out that increased associated depression was present even MIs occurring 10 years after first onset of major depressive event. They have studied all the BMI, family history, MI, cholesterol, the smoking habit, and they have taken around 40 variables as control. They found out that strongest factor was CSD from depression was still significant at odds ratio of 1.7. Then, now we will come to the theory part. What is the connection between depression and cardiac event? What these Americans have studied? They found out that these 4 variables are very important. How the mind is affected by the heart. If the heart says I will die, the mind will die automatically. But the heart says I want to live, the mind will say, okay, you are immortal. The Gita will say, Naina chindante sastrani, nainam dahati pavaka, nachaina klatyante apo, nacha sosyati maruta, adayayam, asusyayam, abhikaryam aymuchyate. You are immortal. The heart, if you keep your heart happy, then this word will come true, that you will become immortal. But if your heart is weak, your mind will say, okay, you go, you die. So what are the mechanism linking depression to cardiovascular mortality? They found out the physiological pathways. Volumes have been written, volumes. They have gone into very much detail how this autonomic dysregulation that occurs in anxiety and depression affects the heart. How the inflammatory processes, the C-reactive protein IL-6, and there is a long list. How the depression affects all this and leads to cardiac mortality and morbidity. How the pro-coagulatory processes and lot they've studied in detail. On each subject, volumes are written. How the shared genetic factors between depression and cardiac disease affect the mortality and morbidity. How this autonomic dysregulation, depression affect the cardiac mortality and morbidity.